My guest on this episode is a leader on local, state, and national levels. She is grounded in a strong belief in eliminating the structural barriers to equity for historically marginalized populations. You're listening to the PHEC podcast, episode 393. The field of public health is so broad, overlapping multiple industries. With epidemiology at the core of public health, there are an unlimited number of ways to target specific populations, health conditions, environmental issues, and causes that matter most to you. My name is Dr. Huntley, and I'm the host here on the Public Health Epidemiology Conversations podcast. I'm an epidemiologist, consultant, and entrepreneur with over 20 years of experience in healthcare and public health. On this podcast, my guests and I engage in conversations that demonstrate the importance of public health and epidemiology across a variety of industries, helping you think outside the box and inspire greater positive impact in communities around the world. Now, let's dive into the topic of this brand new episode. Greetings, everyone, and thank you for joining me on this episode. I can't wait to introduce you to my guest. Before I start doing all of that, let me introduce myself to you. My name is Dr. Charlotte Huntley, and I lead an epidemiology consulting firm that supports nonprofit organizations and government agencies that serve Black, Indigenous, and people of color communities, commonly referred to as BIPOC communities. We are often invited to support tribal organizations, and we're always humbled and honored to serve. We help our clients collect, analyze, manage, and communicate their data and health information in plain language to the communities they serve. If your organization serves BIPOC communities or is genuinely interested in building relationships with BIPOC communities, then please reach out to us through our website, drchuntley.com. We would be happy to meet with you and explore how we might be able to support your organization. The links will also be provided in the show notes. I'm excited to introduce you to my guest on this episode. Many of you already know her, so let me just formally introduce her and then we can jump right into that conversation. Dr. Chris Chanyasulkit is a public health practitioner, advocate, keynote speaker, and master connector. As past president of the American Public Health Association, APHA, Dr. Chanyasulkit is grounded in a strong belief in eliminating the structural barriers to equity for historically marginalized populations. Chris holds leadership positions with local, state, and national governance and civic engagement organizations whose work promotes racial, gender, and health equity. Dr. Chanyasulkit is the author of Successful Public Health Advocacy, Lessons Learned from Massachusetts Legislators. Her signature ability to engage with a diverse range of audiences has made her a highly regarded speaker for students, educators, public health professionals, civic organizations, and general audiences across the country. In addition to her advocacy and scholarly pursuits, Dr. Chanyasulkit is an elected library trustee of Public Libraries of Brookline, a Brookline Community Emergency Response Team member, and a Brookline Medical Reserve Corps member. She is also a board member of United for Libraries, a division of the American Library Association. Dr. Chanyasulkit has a bachelor's degree in biology and art history from Boston University and a master's degree in public health from Boston University School of Public Health. She also holds a doctoral degree in political science from Northwestern University, where she conducted research on health disparities. She is happiest when reading a good mystery at home with her 3 kids, her husband, and their 2 puppies in Brookline, Massachusetts. Let's connect my conversation with Dr. Chris Chanyasulkit right now. Hi, Chris. Welcome to the podcast. How are you?
I am good. How are you?
I'm doing really well. I've had a few minutes to chat before hitting record. It's so nice to catch up a bit and just on all the things. So let's start at the beginning. For our listeners who I think everyone knows who you are, but just in case they do not, why don't you start by introducing yourself and just say a little bit about what you do?
Hi, thank you so much. So, my name is Chanyasulkit. My last name is quite long. And so I say that because it's also Thai, because everyone always wonders, like, what is that? Which is always an interesting way to ask. But I'm Thai Chinese and first generation here. My parents came over from Thailand. And interesting fun fact, my first name really is just Chris. It's not Christina or Christine, which is interesting because I think I've gotten awards to Christine Chanyasulkit and things like that because people assume it can't possibly be Chris. Because my parents really liked when I was born a tennis player named Chris Evert. And I am sorry to say I'm very not skilled at tennis. Despite the namesake. But yeah, I think you and I met because we were at the American Public Health Association's annual meeting, APHA in Minneapolis. Though I think we crossed paths because I feel like I have seen your name on a lot of things. And I am now a past president of APHA, which is always another fun thing to say because people are like, whoa, because while this is a podcast and you might not see me, I would say in many ways I look different from the presidents of the last 153 years of APHA. I look like a youngish Asian American woman, and I am the youngest APHA president I think we've had, but I love it because public health advocacy is my thing. I've worked in health departments. I've worked in, yes, diversity, equity, inclusion. I'm going to say those words out loud.
Yes.
And today and always, but public health advocacy, it just kind of connected everything for me. And it's been such a passion. But at the same time, as you probably felt in that space at APHA, the people that I have gotten to know through my public health family, my APHA family, are now some of my very closest friends and family that I would text with in a literal emergency when both good and bad things happen. So I'm here and I do that. And I spend a lot of time with advocacy now, which fortunately, unfortunately, I guess is more important now, I think, than ever before.
I agree. Thank you for that wonderful introduction. I remember, yes, I think we have crossed paths, and that happens a lot. Like, I think when we get together in our community, you think public health, there's so many people in public health, but it really is, I feel like a little smaller than we think it is. We cross paths and we have some friends in common and colleagues in common. So when we actually sat down to talk at the most recent conference, it felt very familiar. Like, yeah, I kind of know you already, but we're talking this first time.
No, totally. And then there are some people that I've literally met once at a conference and we now text and are, very close because it's just a good way of meeting someone else who, has those same core values.
Yeah,
right?
I agree. And then we were also in a very special space with, I forgot the name of it actually.
The Women's Leadership Institute.
Thank you. Women's Leadership Institute. And what a special event. It was my first time attending that actually, but I will definitely be looking for that on the schedule every time. It was a really wonderful experience and a great way to kick off the event because it was like the day before the official start of the conference. But this is great. I'm excited to have this conversation and get to know you even more. And absolutely, there are no restrictions on words. I guess profanity would be the only restriction on this podcast. But we definitely, DEI, diversity, equity, inclusion is a phrase that is a core part of everything that we do. So there is no filtering out of any of that. We embrace it regardless of how.
Beep it out.
That's right. It is not. It's going to be underlined and highlighted more than likely. Let's start with, this is one of my favorite questions to ask my guests on the podcast. I love to get a sense of where you are now and who you are now and all the accomplishments. But let's roll back to the very beginning. I'd love to know, at what point did you first learn about public health or become interested in public health as a career?
Yeah, so this is funny, and I know we don't have all the time in the world because this isn't my memoir. So I'm going to give it to you in a nutshell. So I am, again, first generation Asian American. My parents basically had said from a very young age, you're going to grow up and you're going to be a doctor, preferably a surgeon. And in your free time, you're going to probably go back to Thailand and cure everyone in the country of anything, and then come back and be your successful surgeon self. So that's why, of course, right? And so that's what I kind of grew up being like, I need to be a doctor. I went to college. I had a double major, including in biology. That's my plan is I was going to go to medical school, but I'm very squeamish. like incredibly squeamish. Very recently, I literally cut off the tips of two of my fingers. It's another story for another time. But there was blood everywhere and I actually couldn't look at them. And I needed my husband to actually bandage and take care of them for me for like a week and a half because I wouldn't look at them. So for obvious reasons, being a surgeon is not probably the best fit. So without giving everyone the sad details, I came to a moment where I realized I wasn't going to go to medical school. It wasn't a fit for me. My parents and I think came to an understanding. I do have one sibling, a sister. She is a really successful orthopedic surgeon who is married to another medical doctor, and they're amazing. And they have 3 kids who I think will probably all be amazing physicians or surgeons too. So we're okay. I think my parents are okay with me now. So that's what I thought. And I really only knew of medicine. Growing up, I knew of medicine and dentistry. I didn't really know about public health. I will be totally honest. I went to college here at Boston University. I had an amazing professor that I met who said, you know what? What about public health? Think about this. And I was like, what are you talking about? He explained it to me, and I ended up going into a master's in public health program at BU, which I absolutely loved. And we had kind of framed it for my parents as a lot of doctors have a master's in public health too. So we did it, but I loved it. And that's where I got introduced to it. I realized, and a lot of it was also related to AmeriCorps, because just before that, I had done a year of service in AmeriCorps, working with community nonprofits all throughout the greater Boston area. And that's where I learned, coupled with what I had been told, this is public health. Like working in communities and making sure people had access to food and transportation and healthcare services and just all the things that people need to live, I realized that's public health. So then I got my MPH. I worked for a while, even at the Harvard Chan School of Public Health. And I still, for some reason, I'm supposed to go to medical school. I ended up, in another fun story, getting a PhD in political science. But there, I got it at Northeastern, focusing in health policy, and was very much inspired and shaped by the work of Michael Dukakis, who was a presidential candidate, 3-time governor here in Massachusetts. And he taught this amazing health policy class. And that's kind of where I learned, really got the nuts and bolts of health policy making and advocacy and government. And I really loved, I used to teach like American government classes to undergraduates, as well as international relations, which got me into the whole global health. So it was just an amazing confluence of circumstances. And then after that, I began working in my local public health department here in my town of Brookline. Loved it, still love them. They're great, right? And that's how I realized it's all public health. I love it. Like transportation is public health. And I'm going to say it here too. Don't beat me. Environmental justice is public health. These things are all public health. And I loved it. And I realized that, and the research shows it's something like 80% of what really matters to your actual health is really what's happening outside of the healthcare services and system. And so that's where I wanted to really figure out, how do I make a change in all that? Because people don't understand it and don't see it. But goodness, if you can't get to work, school, or the doctor's office because you have no transportation, you're not going to be healthy. You're going to have problems, right? If you live in a food desert, you're not going to be able to be healthy. And whatever politics is saying, like, yes, we should eat healthier, we should have not processed foods. Yes, we should. But what about the access to that? Where is it for people? A banana costs so much more than a bag of chips. And soda, for example, the fresh fruits and vegetables cost so much more. Your organic produce, whatever, your organic meats and proteins. It costs a lot more, and people don't understand, like, that really affects your health because that could potentially stave off chronic diseases and diabetes and everything. But we're at this point as a nation patchworking things and really not trying to figure out how to get healthy, where a lot of other places are already doing that and spending a lot less money. I've sort of taken this on as kind of my call to action because I really want to see people be able to live their healthiest and best and happy lives, because everybody wants that, right? You want to be in a place where you can walk around, fresh air, say hi to your neighbors, not be afraid, go for a walk. Really enjoy those moments, have access to the library, read, and curl up with your favorite book or your movie, and have access to that and the internet, for example. A lot of places don't have that. The digital divide is real, and that affects their health. And so these things just all came to fruition. And now I realize it's okay. I've embraced the fact that I'm never going to be a medical doctor, even though I think I got my PhD and my parents said, so now you're going to go get your medical degree, right? And at the time, I literally had 2 children and was quite a bit older and was like, no. So that's in a nutshell how I got to this point. But I see it, and I see it even more now. And unfortunately, I'm all about progress. And oddly, as a nation, as a world, we are not making progress. We are not recognizing how to solve these issues and really tackling that. But instead, our priorities have shifted. Not everyone, obviously. Most people know it. Most people know that they need money to pay for food and housing and heat, right? So, for example, I love the idea of guaranteed basic income. I don't know if you're going to beat that out, but a lot of people think that's crazy. But the research shows people know what they need to pay for, right? And all these other things that people bring up as examples are noise. They're those one-off facts. They're not examples of the true measure of what people know that they need. They want to care for their families and their community.
Yeah. I love that. You remind me of a guest that I had who's very passionate advocate for nutrition, but not spending the time, we have to provide people the food that they need to survive and to eat, let them make the choices that they want to make. And then we can insert the education a little bit later on about the best choices and so forth. But
right, absolutely.
The passion that you have for this it's undeniable. So it kind of perfectly leads to the question that I have for you next. I'm curious to know about the population or condition or problem. You definitely touched on a variety of things, and I think we all are very multi-passionate in this space, and I get it. But is there a particular population or cause or issue that you're most passionate about now?
So it's hard. I feel like, so I have 3 kids, and I feel like you're trying to say which is my favorite kid. And I think it depends on the day or what time of day. In actuality, I think a lot of it really is looking at those core basic public health services are needed at your very local level. And unfortunately, we're also seeing how the federal government affects those local public health needs, largely through funding and policy and legal ramifications and everything. So those core public health, it's really important to me that we support them. We support our local public health departments, and we allow them, because they know largely what their community needs. How do you address those needs? So, for example, I'm here in Massachusetts, and I'm a member of the Massachusetts Public Health Alliance. It used to be called the Public Health Association. We would consider that an association the same way, but they changed it to become an alliance because they're doing everything, looking at food and nutrition and access, but transportation, for example. And they are looking at, and they have their advocacy with many others has allowed, for example, my state in Massachusetts to pass local policy recently that's looking to really help support the funding at all the different public health departments, because we have 351 public health departments and they have all different kinds of funding. And that's bananas, for lack of a policy word, right? Because that's where you need it. That's where the public health is happening. When people needed their COVID tests and their flu shots, and they are worried that they see a dead bird outside, they call their local health department. And so that's where we really need to support them and know that they are these good people who are working in their community because they are part of the community. They live here and they want to do better. So that's, obviously one of the core things that I've always been supportive of. But of course, advocating at the national level, as we see right now, makes a huge difference. Changes at your national, federal level really affect us all across the nation. It affects whether or not people will have access to Medicaid in their state, things like that. And then the other thing that is a passion of mine that became a call to action when I was president of APHA. So I had this amazing ability to go all across the nation and do my call to action, which for me was to play, read, and vote for health. And play because we'd been in a horrible pandemic. People don't play in this. I'm not saying you need to go out and play tennis because, I told you I am no Chris ever, but it could be pickleball, or you could just go take a walk. You could do a puzzle. And in particular, I wanted people to get out and see other people, because the meeting of other folks, if you took a pickleball class, which I ended up being able to do with my local rec department, just because we wanted pickleball, we were all different color, ages, backgrounds, I'm sure. And it was amazing. Go out and meet other folks. Do something that's kind of fun, that's good for your heart. And the research shows that you need that social connection as well. So there's a lot of evidence-based research, but that was one of them, was to play. The second one I said was to read. And that is a real passion of mine, which dovetails right with public health. Despite what you may see in some sources, they are not true. Book banning is a real issue in the United States. Book banning is a real issue for both public libraries, community libraries, schools, universities, and it's a real concern because if you look at the research on it, the folks that are trying to get books banned from your libraries are trying to get books by or for LGBTQ authors, authors of color. And what that does is it makes it so I can't read maybe more about someone else's life or about other experiences that I need to know about. And there is research that shows that then we have a loss of empathy, which as we can see as a nation, we need more of. And I am concerned also about the book banning because as a nation, we need to be more educated. We need to know our history to do better and not repeat history. And just in general, freedom of speech, like, hello, why are we banning books? That's not progress. So that's my other thing. And it's very much obviously related to public health. And I do a lot of advocacy in that space through my membership on the United for Libraries National Board, which is a member of the American Library Association. Fun fact, I love libraries. I love independent booksellers too, but I love libraries too, because they're really that third space where anybody can go to. You don't have to buy a coffee. You can just walk in and have a seat when it's really too cold outside, too wet, or too hot. They have free Wi-Fi. So I'm I'm advocacy about literacy and reading and against book banning. So join me on that. And the last thing that I really talk a lot about is voting. But in particular, I'm really trying to emphasize voting at your local level. I think you and I, and probably everyone listening to this podcast, knows who their state legislators are, knows who their governor is, their mayor and council person, knows all those things, as well as obviously their congresspersons, I'm sure. But I am pretty confident that if all you listeners out there go out and talk to people, just randomly, like as you're checking out somewhere or checking, or getting your hair done or your nails or whatever it is. Not everyone does know. Most people do not know their school committee members, and that determines their school curriculum. So, for example, in my town in Brookline, I am thankful for our school committee because they voted years ago to have the wellness curriculum be based on Planned Parenthood's Get Real curriculum so that it's evidence-based, age-appropriate, and medically accurate, public health-related curriculum of wellness is being taught to our high schoolers, that they know this from Planned Parenthood, and it's an amazing curriculum. But in many places, even in Massachusetts, they do not have age-appropriate, medically accurate wellness and sexual health education. In some of those places and spaces, they just teach abstinence only, which, as the research shows, is not helpful to preventing the transmission of disease or preventing teen pregnancy. So knowing who your school committee, I'm an elected library trustee. We help with our budget and the policies. And if you don't want your books banned at the library, well, you better make sure you know who your library trustees are. All of these local things, they matter. They matter who is running your health department, for example. And what people don't realize, I think they saw it and kind of realized it, but apparently they forgot. In the pandemic, your local officials made a huge difference in your life. It determined whether your kids went to school, schools are open or closed, and school was also where they got meals and social services and healthcare and other things. It determined what stores they might go into and how they would go into it, whether even they could play at the playgrounds. Let's do better and vote really also at your local level. For example, my local elections are in May. Nobody thinks about it in May, okay? So we need to do better. When are your local elections? You have to know so that you can do that. And then the other reason is let's be strategic. A lot of people who are voted in at your school committee, your library trustee, your mayor, your city councilor, those folks will, and we have seen it very soon, often, end up in your state house as maybe your state senator. And then very soon after, they will end up in Congress. And in Congress is where they may end up actually determining whether or not you have access to Medicaid with or without having to work. Or is there a lifetime cap on when you can get access to it? Or Medicare or student loans? They're going to be making those decisions. And we need to be understanding of this pipeline. So we must vote even in our local elections.
Oh my goodness. Thank you for that. I love that. You probably saw me taking some notes on things you were saying.
Or wanting to say, Chris, stop, it's too long.
No, not at all. I'm loving this. And thank you for breaking that down, for sharing that with us. It's wonderful reminders. And it also, you actually gave me some confirmation on some things that were floating around in my head as well. So I personally appreciate this. So if anybody else get anything out of it, that's a bonus. But it was really great. Thank you for that. I'm so glad I asked you that question. This is really, really helpful. I didn't expect that little gold nugget, but yeah, I'm gonna be revisiting that.
Yeah, you should have a book club in your podcast.
I know. I'm thinking, wouldn't that be a great idea? Okay, so now I'm going to go on a little bit of a tangent, but we're in a couple of weeks from the time that we're recording, I'll be hosting an event where I have a small group of people together, public health professionals, helping to pour into their businesses. And I've started a habit of buying books to gift to them.
I do that too. So when I would go around the nation, I would have a book to give away as part of, my talk for the read part. And if you need a book, here it is. So Gardens of Eden is the first in a trilogy. So it's this amazing book by Rosie Lee. And so here's the thing, and this is crazy, but not crazy. She is actually a physician who consults, works everywhere. She's in Georgia. Amazing. Is also a doctor, but writes these amazing family dramas that also talk about health issues. And it's a family color. And it was just the most fun book. Like I had a week once a few years ago and I just sat down and I couldn't stop reading. I was like, people don't talk to me. Like I told my family to get away because I needed to finish this book. And it's not only is it a good book, and I know it's a good book, but it's so good that it's going to be a trilogy now. The second book is coming out. And I feel like it might be a fun book club read because as opposed to those books where it's like, let's read about the history of public health, which might not be like the most engrossing. This is like a fun family drama that has public health lines and is by another APHA member who's also just a really cool chick. She's really nice, woman of color, and just like really funny. Like, I don't know. She's like the type of person like you where I can get on the phone and talk to for like an hour and be like, oh, shoot, it's been an hour. You probably have to do something, right? Or I'll text with her random memes as well as serious and fun stuff because she's both smart, but she's like you, and all the people listening, like we have so many parts of our personality. So the fact that she was like a doctor writing about health themes, but then came up with like the most engrossing family drama for me. This is your book for the next book club, The Gardens of Eden.
What's her name again?
Be a trilogy.
What's her name again?
Rosie Lee. It's a novel by Rosie Lee.
Okay. I'll make sure we get this link. Well, make sure we have links to this in the show notes. So anyone listening?
It's so good. And then she's coming out with the second one, then the third one. So you already know what books you have to do for the podcast. And then you don't have to worry about it.
That's a really good idea.
And I'm sure she could give you, Rosie, but I'm sure she could give you book club discussion topics and all those good things. And I don't know, Rosie, I'm going to volunteer you. Maybe you could do, a book club guest appearance because she's just a really awesome, incredible, multi-talented person. Like She's a doctor, woman of color, works and speaks nationally as well as in her community, but then has this like other side of her where she's writing cool, fun family dramas. I'm literally waiting for it to be a television show. So just so you know, if you want to get in on it before it's a television show, though I've asked her if it was a television show, could she please add in an Asian character and can I be it? But that's just me.
Oh my goodness. Well, thank you for sharing this. I'm going to definitely check this book out. I am always open for suggestions. And I like the book club idea. We're going to have to explore that. We're starting this new community for the podcast listeners. So we'll throw that idea in there for
every community has a book club.
Yeah, I think that's a good idea. That's very uplifting too. Thank you for just your energy. You're absolutely making my day. You know how we were talking at the beginning of recording. So just to put into context, we're recording this February 3rd. So this is like we just come off of the week that has shaken all of us in public health, and we don't know if we're coming or going. And a lot of us. Yeah, I had to go off the grid for a day just to kind of protect my mental sanity. I mean, it's just been a very difficult time. and to be able to have this conversation, this energy. And right now, I just appreciate it personally. And it's what I wanted to bring to this episode for our listeners. I think we need this little glimmers of hope, these little reminders that although this is definitely a reality that we're in, and this administration has kind of turned things upside down, we are resilient and we are individually, we start to do these things that help us to rebuild ourselves, pour into ourselves, like this book. And a lot of the things that you talk about, like your call to action with play, read, and vote. These are all things that remind us that we do have some authority. We have some agency. We can tap into some things that will make a difference on our local level, which trickles up broadly up to the federal level, just as what's happening federally trickles down to us individually here locally. But just thank you, because this has been just such an incredibly insightful and uplifting conversation. Let me ask maybe just a couple of more questions as we begin to wrap it up. I do want you to, let's touch on what you do now, because we talked a little bit about the fact that you do consulting. So I'd like for you to just talk a little bit about that, so that if anyone listening, and we do have a very diverse audience of listeners. So someone may be thinking, oh, she's really awesome, but not even know that that's an option, and you may be a great fit for what they're looking for. So please tell us a little bit more about the work that you're doing now.
Thank you. So I've been doing a lot of different things that I never expected to do before, because again, I was supposed to be a doctor. So I do lots of different places and spaces, whether it's here in where I live in Massachusetts, or virtually, or traveling, outside of the country. I've been doing a lot with different organizations, helping them with looking at their strategic planning, kind of figuring out where they are, what they wanted to do, and where they want to be, and how do we get there in a most effective way in the changing times that we have right now. So a lot of that is thinking about that and helping them work through that. I also do a lot of public speaking on a number of different topics, mainly because I love engaging with others and or sharing not only my ideas, but learning from them. Like I like to say, I tell my kids I learn something new every day. I probably learn like a million things new every day, right? And I feel like the best way to learn is in those connections with other folks, like the community, like you were saying. It's no longer just reading in a book or going to a lecture for me and for many others. It's really like knowing and coming into a space with someone else. So we do, a lot of public speaking, a lot of the consulting, and I'm going to share another fun fact. This sounds crazy, but it happened to me, but it's so came out of my public health and APHA. 100% came out of being an American Public Health Association member. Is I also work, I don't think I told you, as a hobby, is as a travel advisor, because I really am kind of one of those organizational crazy people who likes to keep everyone organized. But I also am now even helping sort of like life coaching with a couple of folks who contact me, and I life coach with them to help them determine their goals and how do we reach them over whether it's 10 weeks or whatever period of time. So I do kind of a jack of all trades. But the travel advising is because I realize life is short and we need to see the world. How can I help all of my friends and family? Largely, everyone's really busy. No one has time to sit down and figure out, I'm going to go somewhere and I want to enjoy my time, but I don't have time to sit here and figure out the best deals and the easiest way to get somewhere and what's the best value for my money and time. So I ended up doing that and I love it, but also because that brings joy. And also I've learned myself personally, and I'm sure you and others know, is when we travel, whether it's outside of our neighborhood or outside of our state or outside of our country, we learn and meet other people and see how they do things, learn maybe better or different ways of doing them, and then also just realize that wherever we go, we may all have different religions and skin color and fashion wear, but we all want the same thing, right? We all want to be our happiest, healthiest, best selves. We want to help the next generation grow up and be their happiest, healthiest, best selves. We want the air to be clean and fresh, right? I want puppies everywhere, and cats too, and kittens. But I have learned that when people travel, they come back to where they are and they're slightly changed. They're better for it. And I also it's now my super fun hobby, because learning and seeing the rest of the world and knowing them is really important, because I think that's part of an issue we have as a nation right now, because it's not just us in America. We are part of a global society and a community. And just by the random nature of us being here doesn't mean we're better than anyone else. And what we do and what they do affects everyone else. And we need to be better than this.
Yeah. I love what you just said for so many reasons. I think we can find public health in everything that we do. How cool would it be to have you and your background and credentials as my travel advisor? Because I made a note for that to remind myself of that. But I also think it's so important that we enjoy what we do. And if we can bring value to something and it lights us up and we get excited about it as well, that's a win-win. We cannot, especially with everything that we're facing now, and this is affecting us here in the United States, but actually the actions here in the United States are affecting global.
Oh,
It
yes.
has, global repercussions. So we can't be defeated by all of that. And we can't be consumed by all of that because it will take us out. But what we really need to do is make sure that we're staying connected to the things that light us up, how we're resting, how we're taking care of ourselves, and how we're doing the work that we know is impactful and making a difference and that we also enjoy. That's huge.
If you are not okay, you can't help anyone else. It's like that whole airplane mask thing. You really can't. I've seen it firsthand, my own self personally, that if I am not well, I cannot care for my children, my puppies, my husband, my community. If I am out, it's all over. And for me, in my space. And that's people I think need to realize that. And I'm not saying, obviously, right now is not the best of times.
Right.
And I'm not saying I get it. I recognize it. Like one of the consulting gigs I have was paid for by a USAID grant. So I am no longer working on that right now because of things. And that's awful. And it took me a couple days just before I could even reply to the emails about that because I was just gobsmacked. But I guess what I say is, if you've studied history, there was a time when women couldn't vote. There was a time when Black folks couldn't vote. There was a time when we had child labor. There were all these times where it was hard, but folks at that time persevered, were resilient. I hate that we have to be resilient,
Right.
but they overcame these things. And I am just hopeful and believe so strongly because I've seen the good in so many people that we will be okay.
Yeah.
And we need to believe that because if you've read history, things weren't great at times, right? And we can do this.
Yeah. Yeah. I absolutely agree. And I think that I love also something you said a little earlier. You mentioned a couple of times of your community, your network of people. It's great that it's important for us to have people that we can text or jump on a phone call and just have those conversations and that get it, that understand us. And the beautiful part of technology is that people like you and I'm in South Carolina, you're in Massachusetts, but we can connect in an instant and support each other and encourage each other and just share a laugh. It doesn't have to be something so heavy all the time. It could just be a simple, I have some people that they know I love puppy videos too. My husband, I convinced him that we lost several of our adult dogs over the years. I said, let's get a puppy and let's just start fresh. And then I said, well, he needs a friend. So I convinced him to get two puppies. So we now are in this crazy phase. They're a year old officially. We're in this crazy phase with these puppies. So I do love everything puppy videos. And sometimes if that's how I escape, I'll just scroll through all the puppy videos because they make me happy.
Yoga. I'm still trying to figure out how to go find that. Like I want to just lay down with a bunch of puppies. I also have 2 puppies. And even though they are in no way service dogs or whatever, no way, they are my emotional support.
Yeah.
And if I could, I'd give everyone a puppy.
Right. But those are the things that we have to be connected to what we need to fuel us and to take care of us. So in that process, it's not just, the puppies are helping me, but we're also helping them. So it's that reciprocal exchange there. But the bottom line is that we're in difficult times right now. And it's okay to have a meltdown, cry it out. Don't try to pack the emotion in, but try not to stay there. And if you need to reach out to someone in your community, we have such incredible people. I think all public health professionals bring that heart-centered type of, you have to be to be in this field. So anyone that's in public health, we can lock arms and get through this together. And I think that that's just an important reminder.
Yeah. And just to also realize that we have overcome serious very awful things in our history. This isn't good, but we can do it again.
Yes.
And now we have AI to help, right? I don't know if that helps, but you just see it everywhere.
That's wonderful. So we're going to wrap up. And in the show notes, I'll tell you how to get to that in just a moment. You'll have links to connect with Chris, the awesome book that she recommended. Yeah. Yes. Because I think we need these little,
read for fun. Yeah.
Yeah. It doesn't have to be, I do that too. I have books that I read for professional development, but then I have books that just because. And we
Absolutely.
need, So thank you so much, Chris, for making some time to come on and have this conversation with me. I know that we were talking about at the very beginning before we hit record, like, what are we going to say? How can we encourage? This is really tough. But this has been such a great conversation. I really appreciate you. I appreciate everything that you do, everything that you shared. Gave me some great notes here and some things to consider. And I'm going to let you know what we do about this book club idea that you recommended.
Awesome. I want to join it. Okay. I'm going to be a member because I am like a super reader. Love this. And thank you so much for everything you're doing, building up this community, sharing, telling me more about you now. Wait, I'm going to make sure I have your cell number so I can send you puppy video.
I want to see your puppy pictures and I'll show you my...
Unsubscribe for me. Thank you. This is so fun. I needed this today.
Yeah, I did too. I hope that everyone listening feels a little bit of a hug and maybe it's something they needed today too. So thank you, Chris.
Aw, thanks.
Well, I really hope that you enjoyed that conversation as much as we did. Chris is a true leader and innovator and is having a big positive impact on all of the communities that she serves. I encourage you to connect with her and learn more about the work that she's doing. You can find all the links to connect with her on the show notes page for this episode. The show notes page for this episode, which is episode 393, can be found at phecpodcast.com. Once you're there, just navigate to episode 393 to find the show notes. One more thing before we go, please take a moment and share this episode with a friend. I'm sure you know someone or maybe a group of people who would be interested in hearing this conversation. If you're listening right now in one of the podcast apps, you can easily share this episode through a text or directly to social media. At the bottom of the show notes page, you'll also find social media sharing buttons, which make it super easy to share this episode with your network. All right, everyone. Until next time, have a fantastic rest of your day. Thank you for listening to the Public Health Epidemiology Conversations podcast. Visit phecpodcast.com to find the show notes for each episode and to learn how to work with me.